In mid-2014, Liberia, a West African nation, was hit by Ebola, one of the deadliest viruses known to humankind. It shattered the health system and claimed over 4,000 lives, as the nation lacked the preparedness to combat this unseen enemy. Six years later, another virus struck.
Before COVID outbreak in this country, WHO together with other partners supported the ministry to develop the preparedness and the response plan. WHO supported the government to have a plan in place and helped the government to operationalize the plan.
To coordinate a robust response, the Government of Liberia set up the Incident Management System, IMS, a body comprising of all key health stakeholders and partners, headed by the Liberian Minister of Health, Dr. Wilhelmina Njala.
We put into place measures that will help us to begin to have a good surveillance and early detection. At the airport, there was a team placed there to begin testing, taking information, screening properly, hand washing, temperature checked, just to monitor who are coming into the country.
We have a two-stage process where we have an IMS leadership structure which advises on leadership and strategic policy decisions, and then we have a wider stakeholder IMS group that actually supports the response, bring in other partners to help collaborate and support the government in their activities to combat and mitigate the spread of COVID-19 in Liberia. And that has been working really well, and we're very appreciative to be part and parcel of that enterprise.
You know, Ebola were resilient. Things went wrong. It was really, really devastating. But we picked up and were able to move on with some lessons learned. So when a pandemic took place, we were at least getting ready to go back to our experience and manage that.
The government had the right plans in place, but maintaining such a huge response became a challenge.
One of the key challenges that we encounter was finances, because in order to run a response, you need to have finances to do it. WHO stepped in, USCDC, USAID, it was those partners that sat around the table with us.
The UN is here to make all Liberians realize that the country, the government, the entire people resident here are part of an international community of humanity. And therefore, when the COVID came, it was important to make every Liberian and every resident here understand that we are in this together. So that was our first concern. And since we are in this together, and since the whole world was affected by this pandemic, whichever lessons have been learned in any part of the world, which could be applied here, we ensured as UN that was the case, it was applied here. And two, that all the standards that we expect from every human being in Liberia, we expected the same as what people all over the world were also experiencing in terms of what we expected them to do.
The U.S. Centers for Disease Control and Prevention in Liberia has been here since 2008. We increased our presence in 2014 in response to the Ebola outbreak. So just as we did during the Ebola outbreak, We're going to have to take a look, once we control the outbreak, the COVID-19 outbreak in Liberia, we're going to have to take a look at the IMS structure and the functions that we have created on the IMS and try to see how we channel that back to the offices, the agencies, the ministries within the government of Liberia.
The IMS structure provided all the partners and stakeholders the platform to bring in their expertise to help support the government of Liberia as they developed a cohesive plan to address COVID-19 in Liberia.
When the COVID hit, we had, of course, a UN country team meeting and agreed on how to support the response. So each agency looked at the resources they had, the comparative advantage they had, and then we came up with which areas to support. WHO, of course, led. We were there to support them. Other UN agencies were involved.
WHO supported the whole aspect, the framework of the coordination for the current response in collaboration with other partners, and reposition WHO staff from all the other programs to be supporting the government in the response.
They came in with supporting a lab, they came in with supplies, laboratory or supplies, paid contact tracers, they paid active case finders.
We were the link between the people of Liberia and its government and those outside who had probably more means, more experience, more expertise than we had. So we have to coordinate with them, with the people who are fighting the disease here, and those who are outside who had things to offer.
Also, as part of its strategy, the World Health Organization, WHO, championed the training of the surveillance officers under the Field Epidemiology Program and identified chains of transmission through community swabbing, which was needful in containing the outbreak. Other UN agencies also diverted their resources to ensure that the government of Liberia remained functional.
We had to provide Zoom license to make sure government keeps on working, even in the midst of lockdown.
About 300 Zoom licenses were procured for governmental ministries and agencies. Meanwhile, the International Organization for Migration, IOM, supported in border control.
Our first mandate was to coordinate all these activities with the government. Our main target, because of the resources, was more limited on the border entries, including the seaport and the land crossing. So we trained all port health staff in all these entities at all the crossings, or in all the 15 counties.
The United Nations Children's Fund, UNICEF, got actively involved in risk communications and community engagement to ensure the right awareness messages were transmitted on public radio and television stations across the country.
We worked on defining what are the key messages that need to go out to the population through engaging young people, through engaging the women's groups, to make sure that we explain in a language that is clearly understood what COVID-19 is and what are the key practices that people have to adhere to, such as wearing the mask, maintaining a safe distance, and continuous washing of hands.
UNICEF also made much needed medical supplies available, including personal protective equipment for health workers. They also got involved in the training of frontline workers.
We have worked very closely with partners, the Ministry of Health, in ensuring that we provide the needed supplies in terms of hand washing stations for schools and also for communities to ensure that we provide the adequate learning material, personal protective equipment for teachers, and masks for the students.
UNFPA supported surveillance and contact tracing. This was based on our experience during Ebola. We trained, I think, initially 105 contact tracers, 20 data managers, 20 case investigators, And then obviously we had to provide the resources for them to work.
UN Women collaborated with the Ministry of Gender to organize some training on trainers for the head of women's groups organization. Our main goal is to ensure women get the necessary information on prevention and protection of COVID-19, and also to ensure that women, they are part of the response, and also their specific needs are addressed.
As the country gradually returns to normal, it is warned that keen attention has to be paid to the transition process.
We should not throw COVID response and embark on teaching health services. Rather, we should get a balance to stop any chance of transmission or re-importation of any case to the country, but also scale up the routine health services.
The reality is COVID is here and is very real, and we should be on our guards to make sure we don't suffer from any wave, second, third, or fourth.
They need to continue what I call the 3 W's: wear your mask, watch your distance, and wash your hands.
It's not over until every country in the world has no COVID-19.
The country was able to defeat Ebola. The country can defeat COVID.
A lot of what we did for this COVID-19 outbreak in Liberia came from experiences we had in actually controlling EVD back in 2014 to 16 here in Liberia.
But we cannot do it if we are not ourselves disciplined to remain to the prescribed guidelines, preventive measures, when we ourselves cannot voluntarily come and get tested.
As you know, the UN Secretary General put up a plan right from the beginning on how to contain the disease. That was the health plan. Soon after, another plan came, urging us to look at the socioeconomic impact of the pandemic and see how we can ensure that the negative developments that came in the wake of the disease would not impact too negatively on the communities, and therefore they might be able to feel strengthened to be able to withstand the shocks of the disease. Immediately after, it was also, we had a plan to look at the recovery from all the financial parts of the pandemic. So generally now we've moved from the health shock. We are tackling the socioeconomic shock and possibly the shocks to development.
Economic recovery plan is already in place between the government of Liberia and the partners, the donors who are willing to bring our economy back on track. You know, the economy took a big hit because of the pandemic.
To support vulnerable traders, the United Nations Development Program, UNDP, has embarked on a $2 million cash transfer.
We hope we could successfully distribute 2 million to them in different ways to be able to not only help them, but I'm sure their injection of that will help the economy of Liberia move forward.
We are going to be looking at the small businesses because they've lost a whole lot. Yes, big businesses have lost. But you're talking about the informal sector, which is huge. The data collection is going on. I'm talking to heads of those small businesses, like the wheelbarrow traders president, the head. We're talking to the market women. We're talking to the vegetable sellers. We're talking about the cross-border people that go to the different countries in the region, Sierra Leone. They go to Ghana, some go to Guinea, some go to the Ivory Coast. So we see what their businesses are all about, what type of businesses they do, where they go. If you're an orange seller, you know, where do you buy your oranges? How many days your oranges will last? You know, what's the little profit that you make on it? So we kind of top it up a little bit through mobile money.
So it was like a combined effort, everybody coming together to respond.
It's been very valuable to work under the IMS structure, where we have all the partners and stakeholders involved. bringing in each and every strength and our own comparative advantage to help support the government of Liberia as they develop a cohesive plan to address COVID-19 in Liberia. It's worked really well. There's been strong coordination at the IMS level, led in this case by the incident manager, the Minister of Health, Dr. Wilhelmina Jala, and supported by all other stakeholders as well. CDC will be supporting the government of Liberia in this enterprise. We will continue to support surveillance. We will continue to support laboratory strengthening. We will continue to support emergency management, continue to support workforce development and infection prevention and control to make sure we provide a cohesive package of support for the Liberian government as they transition from a response phase into a regular phase again.
We were actually fiscally, financially responsible. We were able to take the scarce resources, manage them to be able to do our work. And so if you talk about the counties, county health centers, you talk about the materials, the supplies, our supply chain, what I did with the partners bringing in needed resources, needed supplies. I mean, that was really well managed, and I'm very, very pleased with the Ministry of Health, county health teams, supply chain, the emergency supplies, as well as the incident managers, WHO, CDC, USAID, name all the lingos, all the NGOs, we all work together. And this is what I think is making it successful.
We really applaud them and appreciate them. I think they have done a good job.
The Liberian people have been cooperative, and I want to be the first person to say, I want to thank the Liberian people for cooperating. Job well done. We are reducing the numbers. The death rate has not been too high, and so I can say job well done to the incident managers and the Liberian people. And last but not least, we have to thank His Excellency President George Manewia and his team for really being there. His 1 million nose mask campaign still working. I have them here. I want to thank all the partners, the donors, for what they've done, the support that they've given us.
Over 190 days of response have proven to be effective in flattening the curve. The leadership of the country provided the necessary environment for collaboration for a strong partnership, and the Liberian populace have definitely benefited from this unique collaboration. It is now hoped that the health sector will sustain the importance of community engagement, community participation, and most importantly, community ownership.